If you had an implant placed today, here are some special post-op instructions to follow. If you had sutures placed, they will dissolve on their own unless directed otherwise. A healing abutment was screwed into the top of the implant to help keep your tissue from covering it and from bacteria from getting inside. If your healing abutment feels loose or comes off completely, call our office right away. The tissue may start to cover the implant, and then we have to go back in and surgically remove the tissue. Occasionally, a patient may think their implant fell out entirely. Most of the time, this is just the healing abutment that came unscrewed. This is completely normal. Place the healing abutment in a Ziploc bag and give our office a call so we can schedule you an appointment. Please stay away from little seeds, nuts, chips, and popcorn kernels. These are the things that like to get stuck in the tissue surrounding the implant, which can create irritation, which can lead to infection. Infection can lead to bone loss, and we don't want that to happen. Bone loss is the #1 reason implants fail. If you get something lodged in between the implant and the tissue and can't get it out, give our office a call. We'll help you get it out. In the evening following your surgery, you can start to keep the area clean. Use your toothbrush to brush gently around the tissue surrounding the healing abutment. If bone grafting was placed, please be very, very gentle. It is okay to use your water pick to help keep the area clean, but the water pressure may cause the implant abutment to come unscrewed over time. If you had bone grafting placed around the implant, please wait to use your water pick at least 3 to 4 weeks following your surgery. If you have a temporary crown placed over your implant, please do not bite anything off with your front teeth. The temporary crown is fragile and for aesthetics only, and if you bite something off, it may cause the implant to become loose. If you had an Essex or a flipper appliance placed, please take it out periodically to clean it. This appliance is also for aesthetics only. If you had a denture placed, you can eat as you regularly would. Just make sure to take it out and clean the implants underneath. The final appointment for your implant will be the torque test. This occurs 3 to 4 months after the implant was placed. This is where your doctor tests out the implant to make sure it's ready for that final restoration. The final restoration will be performed at your general dentist's office. If you were informed by your doctor that the implant was completely buried, you don't have to worry about the healing abutment. However, when you return for your torque test, we will have to uncover the screw and place a healing abutment at that time. We hope you find these post-operative instructions helpful. If you have any questions or concerns following surgery, please give our office a call. We are always happy to answer any questions you may have.